speaker tonight is Dr. Nick Brown, and he specialises in interventional radiology with particular interests in interventional oncology, thoracic interventions, sports medicine and uroradiology. Nick has a number of active research interests in oncology, toxicology and nuclear medicine, and has published numerous papers in peer-reviewed literature. He's an honorary research fellow at the Australian Venom Research Unit and also currently holds academic appointments at the University of Queensland and Transitional Research Institution. And if that wasn't enough, he's had quite a varied career outside of medicine as well, living in New Guinea and also a sports journalist for the Sunday Mail, amongst many other things. So please give a warm welcome to Dr. Nick.
It's a great pleasure to be invited to speak tonight. I've been working at the Wesley Hospital for the last 5 or 6 years, and Wesley Research Institute, as it was then, and now Wesley Medical Research, has certainly played a very large part in that, in my life since being here. When it comes to men's health and urology in particular, the Wesley is quite a special place. The capability of things that can be done at the Wesley Hospital, the patients that we can treat, the impacts that we make are quite unique. Most other places who are active in some of the areas that we're active in aren't able to really reach the same heights, I guess, that the doctors and the nurses and the researchers at the Wesley are able to. And one of the big reasons for that is the collaboration that exists in this hospital. It is truly unique, and the urologists, the radiologists, the radiation oncologists, the medical oncologists, the allied health staff, the researchers, the nurses, we all work very well together. And research certainly is a team sport. And it's because of that unique environment that allows us to do the things that we do, the things that we enjoy doing, and as we heard, the things that can really benefit patients. There's no question that there are patients all around the world who are alive today because of the work that has been done through Wesley Hospital and the Wesley Medical Research. And in terms of uroradiology, which is where I work, and certainly in John's specialty in urology, the relationship between urology and radiology is second to none. It's very, very unique. And I guess it all starts to some extent with these two gentlemen, Professor Les Thompson and Rob Parkinson, who first led another Wesley Medical Research-led trial looking at the use of MRI scanning for prostate cancer. And that was certainly the first big major study in Australia and one of the first major studies in the world that really put MRI scanning for prostates on the map. And in such a very short space of time, that was 2014, it is now universally used around the world as the dominant way of scanning prostates for prostate cancer. And the Wesley can be rightly proud to have led the way internationally as part of that study. But it's not just MRI scanning that has us in such a unique position. The collaboration between urology and radiology has allowed us to move on to explore a whole range of new innovations and really expand those horizons. And I guess, you know, John, it's down to us young guys to take the mantle of Les and Rob and see if we can really try and make the most of this. And I think that's really what we've been trying to do these last few years. And you'll get a sense from what I'll say and from what John says about all the things that we do so well. Wesley Medical Imaging is Australia's leading MRI prostate provider. We've scanned somewhere in the vicinity of 18,000 prostates in the last 5 or 6 years, which is more than any other single site in the country. We were the first group to have PSMA PET scanning available in Australia. This is another area where in the field of prostate cancer, it has revolutionised care and has really made a difference to what we can do for patients. that has naturally led on to a field called theranostics. It's a derivation of the diagnostic aspect of PSMA scanning that can actually be used to treat prostate cancer. And we were the first group in Queensland to offer this, and still one of the few in the country that are able to provide this service. Certainly ours is one of the largest in the country, and the expertise across the board in radiology and urology to make that happen, and I might add medical oncology as well, has really been has had a large impact on the lives of many patients with prostate cancer. We were the first group to really embrace MRI-guided prostate biopsies in Queensland, and I think we are still probably one of the leaders in that field in terms of the numbers that we have performed. And this is, again, making difference to patients' lives. It's improving the accuracy of the prostate biopsies when it's needed, and as a multidisciplinary tool, it has meant that we're able to provide a much better outcome for patients. But it's not just prostate cancer that has really seen Wesley lead the way. We're also embracing new treatments and expanding new horizons when it comes to benign prostate disease. Benign prostate enlargement is something that affects just about every male if they live long enough, and it can really have a very significant impact on their quality of life. And so actually through collaborations with John and colleagues like Dr. Anthony Kiasoglis, we've been able to launch basically Australia's largest prostate artery embolisation service, and that has been based very much on clinical trials, on research. We were the first Australian group to be doing research in this area. We have 2 additional studies underway, and really the benefit here is it's expanding the options that men have available for managing this condition. I mean, John and I can both attest to the fact that patients have received excellent outcomes as part of a multidisciplinary approach to treating prostate disease. So the 2 new trials that we have underway are expanding on the initial study that we have that we performed and reported in the literature last year, and again Wesley Medical Research are involved in helping to support that. And that brings us, I guess, to the culmination of a lot of that work, and that is in the Magnify trial. It's because of the very generous support of a number of people in this room that we're able to even talk about this study tonight. But it is a world first study looking at the new reformulated nano MRI contrast agent that actually allows us to, we hope and we think will allow us to scan patients with prostate cancer and detect lymph node metastases much more effectively than we ever used to be able to do. This is a collaboration with our colleagues in the Netherlands at Radboud University. They also collaborated with us on the project back in 2014 that I mentioned that Les and Rob did on MRI scanning for prostates. And again, it's on the back of that strong relationship that we were able to be in the box seat globally to actually run this study. We'll be running it in conjunction with the Garvan Institute in Sydney, and we'll each be recruiting 60 patients to this study. And so this is what this is all about. We inject a contrast agent into the veins of a patient, and then the next day they come back and have a special MRI scan. In the 24 hours since the injection or the infusion, what's happened is that the lymph nodes take up this special contrast agent. It turns normal lymph nodes black. As you can see down in the bottom picture, the bottom part of that lymph node is turned black. But what it also lets us see is lymph nodes with metastases in them that don't turn black. And we're able to differentiate between what is a normal looking lymph node and what is a potentially diseased lymph node that contains cancer. And actually having a much greater accuracy and a much greater resolution to detect which lymph nodes may potentially have cancer in them makes a big difference to treatment planning. This is just a sample study. I don't think I have a pointer, or do I? I can use my hands. These are 2 lymph nodes in the circles. You can see this is the same scan lymph node that's turned black, And in this picture here, you can see this lymph node remains white. And so that's a lymph node that has cancer in it, and we can use this new contrast agent to detect that, we think, much more reliably and to a much smaller size than we can previously do. This study is about combining the benefits of PSMA PET scanning with this new nano MRI contrast agent. And our hypothesis is that by combining these two scans, we'll be able to much more accurately detect these lymph nodes and determine what the appropriate next steps will be. So we're looking for patients who have high-risk prostate cancer, so they're at high risk of having lymph node metastases, and we'll be comparing these results to the pathological results after surgery. So the patients will have their prostate and their lymph nodes removed, and we'll be able to correlate the results from our scans to the results from the pathology. And as I said, our hypothesis is that by combining PSMA PET scan with Combidex lymphography, which is the technical term for it, then we'll be able to improve the detection and the accuracy of these lymph node staging. So what does that mean? Well, we'll be able to detect lymph nodes with metastases in them much, much smaller than we can at the moment. We'll be able to improve our detection of these lymph nodes so that they can be targeted either via surgical means or by other focal therapies such as radiation, and that could potentially cure a patient. Or we could prevent unnecessary lymph node dissections, whereas we have to use best guess at the moment. If we can get the Combidex MRI scanned lymphography working, then we'll be able to be much more certain in our prediction of which patients do and which patients may not need lymph node dissections, and that's certainly going to improve the quality of life for a large number of patients. So you can see that we do a lot. We're very busy. I think we have a very unique set of people here. I think our relationship with each other is also quite unique. But it's certainly, as I said, a team sport, and it's due to the support of a lot of the people in this room that we're able to do what we do. We enjoy what we do, and I think stories that we heard before really make it all very worthwhile. So thank you very much for your kind support, and long may it continue.